Well, from vaccines to health research, the country's public health system has gone through major cuts and changes in recent months under the Trump administration. Now, a group of 15 governors is taking matters into their own hands by creating an alliance to coordinate their public health efforts. The Governor's Public Health Alliance will focus on sharing data and communication about health threats, emergency preparedness and response, public health guidance, and deployment of experts. And one of the reasons a few of the governors say they are doing this is because they feel under the Trump administration, states have been left behind when it comes to public health. And one of the advisors for this new alliance is former Centers for Disease Control and Prevention Director Dr. Mandy Cohen. She, of course, also used to run the North Carolina Department of Health and Human Services, and she joins us now. Dr. Cohen, always good to see you. Let's just have you take us sort of behind the scenes of how this alliance got started and why you believe this is needed right now.
Well, first, always great to be back. And look, there are health threats at our doorstep, and that hasn't gone away, unfortunately. And, as someone who has led both at the state level and at the national level, I know how important it is for governors and states to be engaged in coordination and collaboration on health threats. We learned in COVID that viruses do not respect state borders. And so it is really important for us to be working across border, sharing best practices, sharing data and information so that we can protect communities in all parts of the country.
Before we get to a few more of the specifics of what the alliance is going to do, what's your level of concern in terms of, been a lot of concerns, especially from Democratic governors, about some of the things that might be falling through the cracks under the Trump administration when it comes to public health. What do you fear is getting missed right now when it comes to public health and what states need to know?
Well, we've seen a lot of cuts in people and budget at the Centers for Disease Control, where I was the director until January of this year. And we even saw more cuts just in the past week. And that has direct impacts on states and their ability to keep folks safe in their communities. 80% of the dollars from CDC actually go to states and localities. So when you're cutting the CDC, you're cutting state budgets as well, which means states don't have the resources they need. Again, it's why you need to get creative, get collaborative in this moment. In addition, we're seeing less data sharing going on overall across the country and frankly internationally as well. So important for states to be engaged in this moment to make sure we have as much awareness as we can about health threats and about solutions and being creative. I would also say CDC is often a backstop with experts. So if a state is having a particular outbreak, let's say on measles, on lead poisoning, on HIV, they would send experts, the world's leading experts from CDC, and we would deploy them to a state or locality, again, when we were invited. Those folks are not there. They've been, unfortunately, budgets have been cut. They've been laid off. And so there's not that kind of expertise to deploy. So again, even more important for states to rely on each other. And again, this is not about Democrat or Republican. We know that these are important issues regardless of party. I saw that in North Carolina, where we are a purple state, worked well together across the aisle. I saw it as CDC director. So I see these as universal, issues that we all need to work on together.
Yeah, I mean, you've got 15 states right now. Right, from my understanding, all the governors right now are Democratic, but you've got political advisors who are Republican and Democratic that are taking part in this alliance. Do you know, I mean, is there hope that this alliance would expand to reach more than just 15 states? And is that communication sort of available if a Republican governor in a Republican state wants to reach out and say, hey, can we get some insight into what's going on with this outbreak or actions that we can take, that communication will be there for them?
Oh, absolutely. The door is open here. And in fact, we're having good conversations with many, many states, purple, blue, red, And the 15 that started this alliance, again, I think that is just a version 1.0. I think we're going to continue to grow, and I hope to see all states be part of this work so that we can continue again to backstop some of the cuts we're seeing at the federal level. Again, we know that disease does not stop at our borders, so more important than ever for us to work together and certainly want to be helping states in all corners of our country.
One of the things that the Alliance has already worked on is taking a look at preserving access to the COVID-19 vaccines following actions we saw from the federal level on that sort of changed how vaccines were distributed. There's been a number of changes on that. We won't go into depth on it, but I'm curious, given that you were front and center on the response to the COVID-19 outbreak in North Carolina, what was the level of communication between states then, and how do you sort of, are there things that can be replicated with this new alliance when you talk about potential outbreaks, measles, whatever it may be, forming?
Yeah, COVID vaccine policy is a great example of why coordination at the governor level is really important. We know in public health, not all of the tools to solve problems around vaccine access, for example, live in public health. A lot of those tools live in the insurance world, right? Either in Medicaid coverage or commercial insurance coverage, which means those tools might be in the insurance commissioner's office or the Medicaid office, which means the governor bringing all of those levers together across the state to solve a problem is really critical, right? So that's exactly why we want to support governors' offices to solve problems in public health. It could be on vaccines, it could be on the cost of prescription drugs, it could be on outbreak response. Those are the kinds of things, again, that leadership at the governor's level is really important, in addition to the really important coordination that is happening at the public health level. I want to acknowledge the really good work I see in states coordinating at the public health director level, right? Doing that technical work that is really important. This new alliance is about bringing governors together, again, knowing that solving problems at the state level sometimes you can't do it just with public health alone. We saw that in COVID. We needed different levers of government to help solve problems.
You see this also taking part when it comes to stockpiling medical supplies?
Well, look, when you have more states that collaborate together, you can potentially pool your resources together to purchase, right? You have more market power or leverage. And so we definitely used some of those opportunities during the COVID crisis. Maybe there may be opportunities to do that in the future. I think most importantly is sharing best practices. How are folks going about tackling hard problems so that if someone in the Northeast is unlocking a creative solution, then someone in the Midwest can take advantage of it as well.
Dr. Cohen, only about 30 seconds left, so I apologize, but do you see this alliance taking a public-facing approach as well? A lot of this is sort of communication behind the scenes, but do you see this alliance sort of releasing public statements that might even counter what's coming from the Department of Health and Human Services led by Secretary Robert F. Kennedy Jr.?
Right now, I see it in a support role for states. I think states have been doing important work. It is where the authority lies for different kinds of regulatory authority, coverage policy. So again, I think states are in the driver's seat here. The alliance is meant to support states and their governors in the hard work that they're doing each and every day to keep folks safe and healthy. And I'm, proud to be part of this. And again, I think it will continue to be important as we bring more states into this work, again, to keep people safe, to keep them healthy.
Former CDC Director Dr. Mandy Cohen, always good to see you, and thanks for your insight.
Thanks for having me. Stay well.